Okay, Dr. Cook, that sounds good. So we'll talk again in about 2 to 3 hours. That sound good? Okay, good. All right, so let's update this board since a few things have kind of changed in our situation here. So now you have your epidural and it's working well. So pain-wise, you feel like we're doing okay? Perfect, awesome, okay. So we'll just jot down here. So epidural in and make sure it keeps working. All right, the other thing that kind of changes now that you have your epidural is your legs are not going to be strong enough to walk. So we've placed that catheter in so that you don't have to get up and go to the bathroom, but position changes remain very, very important. So instead of up and walking to continue labor progress, and your pain's well controlled with your epidural now, but we're still going to continue to reposition about every 30 minutes or more frequently if we have any concerns with you or baby. So frequent position changes in bed. As far as baby, we have no concerns right now. Your baby has done really great. Sometimes with the epidural, that can impact baby's heart rate, but everything's looked really good. So we don't need to do anything other than continue to monitor with baby. So now, again, that you're in bed, movement will just look a little bit different. So we're not going to be up and walking quite as frequent, or not at all, rather. You're not going to be up walking. So we're going to continue with the frequent position changes. And as you remember from our conversation with Dr. Cook, the contractions have spaced a little bit, and we know from our conversation that the hormones have been diluted a little bit with the IV fluids that we gave you to have the epidural safely. So we talked about adding Pitocin, and you and your husband had that great opportunity to ask any questions that you might have. And it sounds like we all as a team are in agreement that Pitocin would be a good decision at this point to get those contractions a little bit more frequent and stronger again like they were prior to the epidural placement. So we're going to continue to do position changes. We're going to add some Pitocin to make those contractions a little closer together. Sorry, pardon my horrible writing, guys. And if anyone else wants to do the scribing, you guys are all welcome to add little fun things on there. Okay, so Pitocin to increase contractions, frequent position changes, and then when Dr. Cook comes by in about 2 to 3 hours, we will, if it's a good time to do so, we'll talk about breaking your water. So it is 12:45 right now, so 2 to 3 hours would be 2 to 3 o'clock. So we'll plan on seeing him then. And now that you are 6 centimeters, we consider you in active labor. So we can move our little progress line here. Woohoo, go team!